I think most consumers come in with expectation of pain reduction, right? That's the number one reason for pursuing clinical care is make me feel less. And we're actually, as a discipline, not very good at it. Like there's a lot of better pharmaceutical agents that really can take the edge off pretty quickly with minimal impact and minimal effort on the consumer. So part of this, I think, where the individual enters the system is educating that individual about the expectation of what each modality, each clinical modality, including surgery, including physical therapy, will do to you and your state through that trajectory of your clinical care. And what we are good at, if you look at the treatment effects, and we'll feature this article later in our notes for the podcast episode, JUSPT 2024, the study by Azvazar, which was titled "Which Portion of Physiotherapy Treatment Effect Are Not Attributable to Specific Effects in People with Musculoskeletal Pain," a meta-analysis and placebo-controlled trial. You divide a treatment into 5 categories: pain reduction, quality of life, physical function, depression, and general wellness. And so for pain reduction, we are barely scratched the surface. For quality of life, we're actually pretty impactful if you look into the entire course of care. For physical function, we are brilliant. We are good, disciplined to improve function. People who consume our services do better with their general function when you evaluate it. And then depression, like that's one of those things that we don't highlight, but physical therapy is actually a good modality to reduce some of these behavioral traits or some of these negative behavioral traits. And we're good at treating, not treating, I should say treating depression. We're good at impacting depressive traits when somebody consumes physical therapy versus surgery versus non-physical therapy based modalities. And then general wellness, right? Like the state of well-being. We're also good at impacting that specific state of being from our encounter.